Yeah, so ivermectin is one of those things that a lot of people still keep fighting to get in the hospital, and it doesn't work. So from anecdotal evidence, or let me take it back. So the scientific evidence is there's no data. CDC, NIH, and the WHO do not have any data to suggest it works. And there are trials done in Oxford, England, that are random controlled placebo trials. So these would be legit trials. And so far, it's not really expected to show anything except for the ivermectin doesn't work for COVID. Ivermectin is used in humans. It's safe at specific doses, but again, you don't want to use it if you don't have a parasite infection because that's the only thing it's studied for and effective for. As far as what I've seen in the hospital, back in March of last year, when we had our first patients and didn't know what the heck to do, we did give patients compassionate use for ivermectin. So patients who were on the ventilator for very long periods of time, we would give them hydroxychloroquine. We gave them pretty much everything but the kitchen sink. And what we found is none of them really worked. And then the only thing that really works is Decadron, which is a steroid, which helps stop the inflammation. And also remdesivir, but that's kind of like 50-50 now that we have more information. And also Regeneron and other monoclonal antibodies we use. So the consensus right now is you should not use ivermectin, even if it's for prophylactic or preventative reasons, because you have these unwanted side effects and it can cause, nausea, GI tract issues, seizures, all these things that you don't need to do. And instead you can get something that's extremely well studied and safe, and that's a vaccine. And it's a one-time thing and a short period of symptoms, and it's much safer. Yeah, no problem. Yeah, ivermectin is one of those things that people keep bringing up. And as a pharmacist and someone we've actually used it on COVID patients for compassionate use, it doesn't work. It's really, you're just adding something an unnecessary poison to the body. And when you practice medicine, or at least when I practice medicine, I usually take the less is more approach, which is, optimize medications, only do what is studied, and help the patients out, advocate for the patients in that aspect. So if anybody asks you about ivermectin, you can always say that NIH, WHO, and all of the big governing bodies who've studied this extensively have not seen any real data. And anything, it'd be harming the person.